Hello everyone, my name is Jo Billington and I am a doctoral researcher at the Centre for Autism at the University of Reading, and I am delighted to be speaking today at this interdisciplinary Autism Research Festival. Thank you to the organisers for including me in the programme. Today, I would like to talk to you about a study that I'm working on called I Liked School, but School Didn't Like Me, Reflections on the Autistic Mainstream Primary School Experience. Just a content warning before I continue. My talk refers to the bullying and marginalisation of autistic children, and the participants in this study refer to some teachers as being instrumental in their invalidation at school. So if either of these themes that I mention have a personal relevance for you, then it would be wise to engage in self-care and prioritise that as you're watching the talk. Just to provide some context for this study, identified autistic children and young people accounted for just over 1% of the English state-funded school population in the last academic year. So that's just over 150,000 children in all. And this is likely to be an underrepresentation because these data relate to those children who are identified as autistic. And as we know, there are many barriers to identification of autism. So as I say, this is likely to be an underrepresentation. But of those children, around 62% are educated in mainstream schools, and the same percentage of those don't have an education, health and care plan. So that's the highest level of statutory support available in our education system. So essentially what we know from these data is that the majority of autistic children are educated in mainstream schools, and the majority of those children are supported using the skills, resources and knowledge that's available within the individual school, as opposed to having higher levels of support that involve multidisciplinary teams, annual reviews and statutory legal obligations on behalf of the local authority. But when we look at the experience and the outcomes of autistic children in mainstream schools, we know that in relation to their neurotypical peers, autistic children and young people are less likely to reach the expected levels of academic achievement. So there is a big attainment gap between autistic and non-autistic children that can't be completely explained by academic ability. They are more likely to experience bullying and social exclusion, and are more likely to be formally and informally excluded from school. They're more likely to experience mental health difficulties, and they're less likely to receive timely and appropriate support for those difficulties. But when we look to the literature to try and find research related to how autistic children experience school and how they make sense of those experiences, we find that actually there is a challenge in identifying the autistic voice. So this chart comes from a previous piece of work that I've done, which involved a systematic review of the qualitative literature. And as you'll see here, out of 385 papers, only 4% of those related to the child's lived experience as expressed by the child. As you'll see from the chart, the majority of respondents in those studies were parents, teachers, and other respondents. So they included allied professionals, but also neurotypical peers as well. It's worth noting that in the 4% that constituted the actual autistic child being engaged in the research process, only a very, very tiny amount, in fact, only 2 children were of primary school age. So again, real underrepresentation in the literature for the autistic voice, and particularly for younger autistic children. So the aims of my research, my PhD thesis, is really predicated on these aims, and that is to give primacy to the autistic experience by looking into how autistic children and young people describe their everyday experiences and how they make sense of those experiences. Also, to look at the practical implications of those experiences. So to look at what works and what doesn't work at school in terms of peer and staff support, but from the perspective of the autistic child rather than their families, their teachers, their peers, etc. And the focus of my research is on those children in primary school and also those learners without education, health and care plans, because they are the ones who are most underrepresented in the literature to date. And also they represent the majority of children in mainstream schools. So in terms of my PhD, it consists of 3 studies. Study 1 was a systematic review of the literature, which I mentioned earlier. Study 2 is a focus group study and one-to-one interview study, and that's what I'm going to be focusing on today. So this is engaging with autistic young adults, looking back at their primary school experience. So looking at the views of those who've already been through primary school. My next study, study 3, which will be taking place hopefully next term, will be looking at the views of those children who are currently in years 5 and 6 of primary school and documenting their experiences. So in terms of study 2, the focus of my talk today, in terms of participants, we had 6 in total, 2 of whom were male. They were aged between 19 and 24 years old, and all were enrolled in further or higher education. The interview schedule that we used for both the focus groups and the one-to-one interviews was based on a central question, which was, what was primary school like for you? Sorry, just move back. So the method that we used was predominantly a focus group data collection method, but we did offer one-to-one interviews for any participants who felt that they wouldn't feel comfortable in a focus group setting. And in fact, one of the participants chose to have one-to-one interviews instead. And we felt that the psychological safety of the participants was a key concern in this study. So not only did the participants have a choice of how they engaged in the research, but also we made available a clinical psychologist who has extensive experience of providing support to autistic people. We made her available for any participant at any stage in the research process if they wanted to get extra support, if the engagement in the study meant that they raised some difficult memories or difficult feelings for them. Both the focus group and the interviews were audio and video recorded and were transcribed verbatim. They were thematically analysed, and the team included 3 researchers and 2 research assistants, one of whom was autistic. And the study was conducted in consultation with 2 autistic adult mentors who gave guidance on various aspects of the research process, but particularly with regards to the tone, the communication, the wording that we were using, and the appropriateness of how the research was communicated. So in terms of results, 3 themes were constructed from the data: the costs of difference, the labelling dilemma, and the value of hindsight. Because this is just a short talk, I'm only going to focus on the first theme, which was the most significant theme in the data, and that was the costs of difference. So in the next session or next section of this talk, I'm going to be using quotes from the study. I'm not going to read these quotes because the voices of the participants belong to the participants, but I will leave a little bit of extra time before moving on to the next slide, so that you have time to read the quotes, because they've been chosen as exemplars of the key themes that have been constructed from the data. So in terms of the costs of difference, all the participants referred to feeling different from an early age, well before they discovered that they were autistic. And this difference was universally experienced in negative terms. So I hope you've had a little bit of time to read that quote. I'll move on. And the participants described their differences in communication, behaviour and learning styles as being seen as largely deviant. And this often resulted in them receiving sanctions or indeed sometimes punishment because of that. All the participants felt that their differences made them targets for bullies. Many of the participants had experienced physical bullying, such as pushing and shoving and punching and so on. But some of them felt that actually the less overt forms of bullying, such as shunning and very subtle forms of social isolation, were the hardest to cope with, because sometimes it was very difficult to kind of identify them very clearly, and that then made it very difficult to be able to engage in any kind of help seeking from supportive adults. Not all of the participants in the study had access to extra support in school, but those who did have access to support and accommodations actually felt that that access to support increased their vulnerability to bullying. It made them more visible to the bullies. And up until this point, everything that participants were saying is reflected in the broader literature. There was nothing new at this point in terms of what we already know about some of the issues that autistic children and young people have in schools around bullying. But what did appear to be new is the fact that the participants reported not only bullying from their peers, but also from their teachers and school staff. And this had the impact for some participants of actually discouraging them from going to school, from attending school, and also for others, increasing their anxiety to the extent where they had quite overwhelming physical symptoms of anxiety. And when, during the interviews and the focus groups, when we were trying to explore the nature of the bullying by teachers, much of the participants' recollections were centered on teachers saying things that implied that if the participant was less autistic, that their life would be easier in some way. And actually, what was clear from the conversations and the interviews was that the teachers may have actually thought that what they were doing was in the best interests of the child. That it was actually wrapping up, it was all wrapped up in good intentions, but actually these encounters added to the participants' anxiety and their sense of marginalisation. And the additional support that was given to some participants also actually contributed to their sense of being other in some way. And this was a really interesting theme that was raised in their responses, in that some of the interventions that some of the autistic children received while they were at school actually wasn't helpful, and also contributed to them feeling even more alienated. When we look at the education and psychology literature related to bullying in schools, it is universally regarded as a child-to-child phenomenon. And I wasn't able to find anything in the literature that related to adult to child bullying. But when we look at the definitions of bullying in the literature, we see that it's something that is defined as occurring between individuals where there is a power imbalance, that it is repeated over time, and that is intended to harm another person. And this is where, when we think about the role of school staff, perhaps that third aspect there, the intention to harm, perhaps is something that's a bit more difficult to accept. We would like to imagine that school staff do not have the intention to harm another person. So actually, something that could be a better fit for describing what has happened to the participants in my study is to look at microaggressions and microinvalidations. There isn't a huge amount about this that's written in the disability literature, but it is something that features frequently within the race discrimination literature. And microaggressions are defined as frequent, subtle, verbal, behavioural or environmental hostilities that are directed towards a person on the basis of an aspect of their social status. And a particular form of that is a microinvalidation, which is characterized by hostilities that exclude, negate, or nullify the psychological thoughts, feelings, or experiential reality of a person because of a particular characteristic. And these can be intentional or unintentional. And I think that this is arguably a better fit for describing the kinds of experiences that the participants in my study shared with us. So thinking about the hostilities as invalidating their characteristics, their psychological reality. And the psychological impact of those microaggressions and invalidations was considerable and was still being felt into their adulthood. So there have been lots of questions that have been raised by this study and the systematic review that I conducted prior to this, but I've picked out a few that I think are worth contemplating, certainly within the context of this research festival. And that is the first one: to what extent has research historically contributed to the silencing of autistic children and young people, and how might that be addressed? To what extent do autistic children contribute to the policies and practices which underpin our education system? And what are the unintended consequences of school-based interventions for children and young people with minority neurotypes? And how might the differences in power play out between neurotypical school staff and neurodivergent pupils? And I think it's really important that autistic children and young people are at the centre of the research that relates to them, and indeed in terms of the support that they receive in school. Autistic children, in my experience and also through the research that I've conducted, know exactly what it is that they need in order to thrive in schools, but it's just not very often that they are consulted in those decisions. Some references for the other papers that I've cited in this talk, and thank you very much for listening. Here is my email address and my Twitter handle. Please do get in touch if you have any questions or comments that you'd like to make. Thank you.